How to build a managed healthcare practice. Hi, I'm Dr. James Machino. Building a managed healthcare practice means that patients have acknowledged that you're the trusted expert in providing them with evidence-based, complementary advice involving dietary, exercise, and supplementation management of musculoskeletal conditions and also non-musculoskeletal conditions. The things that are on their mind that really they're concerned about in terms of their long-term health. High cholesterol, high blood pressure, diabetes, osteoporosis, prevention of Alzheimer's disease and age-related memory loss, autoimmune diseases they may have, arthritic conditions, eczema, acne, rosacea, seborrhea, liver conditions, prostate enlargement, menopausal symptoms, fibrocystic breast disease, uterine fibroids, PMS, endometriosis, migraine headaches, recurrent urinary tract infections, how to prevent cancer, how to improve compromised immune states. All of these things and more. Patients have many of these comorbidity problems when they come into your office, and they need help in terms of lifestyle management of these things. Or they're interested in knowing how to prevent health conditions they're concerned about because maybe there's conditions that run in their family like colon cancer, prostate cancer, breast cancer, ovarian cancer, uterine cancer, pancreatic cancer, a heart attack prematurely, stroke, Parkinson's disease, Alzheimer's disease. They're saying, if someone could just show me how to prevent this, what things I could do to help optimize my chances of longevity, I'd be very grateful. So how do you establish yourself as the expert? How do you actually take control of this vital area of health management with your patient? Well, it's 3 easy steps. That's all that's involved. And remember, the steps have to accomplish the following. It has to be time efficient. I know you don't have hours to spend and devote to this area. Also has to be cost effective. It has to generate more income for the practice, and it has to attract more new patients. And that only makes sense. And finally, it also has to be a program that offers patients accurate information based on their health status, so you can truly improve their quality of health and their quality of life and serve the higher purpose. So this is about giving people the right information. So what are the 3 easy steps to make this happen? Well, number 1, you have to gather in an efficient way all relevant information upon which to make your recommendations around diet, supplementation, and exercise. And those, I've done this for you. I've created a free online nutrition, lifestyle, anti-aging assessment. What does the assessment do? It looks at the person's age. And why? Because certain genetic time bombs go off as you get older that increase your risk of certain diseases. That'll be explained. So it looks at the age, looks at the person's gender, it looks for signs and symptoms of existing nutrient deficiencies. It looks for lifestyle behaviors that are already depleting the person of certain nutrients and drugs that might be depleting certain nutrients. It looks at their body composition, calculates their body mass index, does a complete dietary analysis. It identifies the health conditions that they already have, where diet and supplementation have been known to be important in the management of that condition. It also identifies health conditions that run in families that maybe a family member has had, a first-degree relative, where we can help them understand what are the lifestyle practices that can help to suppress that from being triggered in their own body to the best that science offers right now. It also identifies drug-nutrient interactions to make sure you don't give somebody a supplement that actually is contraindicated and may have a dangerous interaction. And then it identifies other health conditions they may have where certain supplements or dietary advice may actually be inappropriate or contraindicated, or where certain types of monitoring may be appropriate. This is the only responsible way to provide patients with relevant information. So, how does the person take the test? Well, there's different ways to access it. One way, if you want to check it out for yourself, is just to go to naturalhealthtest.com or adivainfo.com. You can take the test right there and you'll see that it's highly accurate and very comprehensive. So when you want your patients to take it, they go online, they can just do it. You can set aside a certain area of your office. They can do it at a computer in your office, or they can do it at home. And if they do it at home, They can email the results to you, or they can print it off and bring the report to you. It only takes them 15 minutes to complete the assessment, and it instantly generates the report. And what I've done to make it easy for you is there's a summary at the end of a report that really highlights the key findings. So you don't have to read all 15 or 20 pages. You can go right to the summary on the back where I've highlighted, you know, the nuts and bolts of what you need to do for this person. They can read all the details in the report on their own time. So if they've done it at home, they can email it to you, or they can print it and bring it to your office. So the first step is to have them do the online assessment. I've already done all the work for you. You just have to review it. So you set aside, step 2 is you set aside 20 minutes to have a wellness consultation with the patient. And you review the report. But I don't know everything about the patient. You need to fine-tune that report based on your physical examination findings, your orthopedic findings, your neurological findings, their overall state of health, their fitness level, the level of compliance you think you're going to get from that patient in terms of making lifestyle changes. And then prioritize the things you want them to do first, second, and third as time evolves so it's not so overwhelming for them. So the first step is you get them to do the assessment. Step 2, you set aside 20 minutes where you review it with them and fine-tune the results. And step 3 is you recommend supplements to them that are going to be the ones that are best suited to their situation, and you give them the background educational material that goes with that, that's targeted so they understand it better. So in this case, we want you to use Adiva supplements that I've formulated, but Adiva doesn't make everything. You may also need to have some other things in your office as well that Adiva doesn't make. What's important is that you're dispensing supplements that are professional grade supplements where the dosages have been proven in human clinical studies to produce certain outcomes. And then to help them understand it better, you hand them a brochure. Adiva makes brochures on all the different products so they understand it. And they can also go to the Adiva Info homepage, and if they have a condition, let's say it's multiple sclerosis or fibrocystic breast disease, right on the homepage they can click on that condition and they can really read more about it. They can also see the features and benefits, the clinical features and benefits of all the Adiva products so they understand more details about it, contraindications, the dosage is all there at adivainfo.com. And when they click on any of the supplements, there's also a short video that I make on each one of our Adiva supplements to help the consumer really understand why the formulation was created the way that it is. So these are great resources for you to have. Now, an optional step here is that you could ask the patient also to bring you a copy of their most recent blood work, just the same way you would ask them to bring a copy of their most recent x-ray results. And on adivainfo.com, you'll see that I have a little link to the interpretation of blood results, which explains the optimal level for each blood test and also what is the meaning of that blood test to make sure the patient is in the ideal range as best as possible for longevity and prevention of disease. If you want them to get some blood tests done, I also have a form there you can print off, standard blood tests, and you can check off, just to save you time, check off the ones you want the person to get done, or have them take it to their medical doctor and suggest these would be blood tests that would be worth viewing based upon your evaluation of the patient. And I have other additional resources. At adivainfo.com, you'll see I wrote a compendium on vitamins, one on minerals, one on herbal supplements, one on accessory nutrients and essential fatty acids. So if you're looking for information on any nutrient, I have monographs there that explain in clinical studies how each nutrient has been used, drug-nutrient interactions, the dosage, the standardized grade. It's all there if you need to learn more about a particular nutrient or the patient can access it. I've published more than 200 different articles, review articles on everything from the natural management of menopause to prostate enlargement to adjunctive nutritional management in cancer. I have these articles available to you. If you contact us, I'll be able to send you a lot of information. So if you have any question, simply phone us at our 800 number and speak to our Director of Chiropractic Resources. The number is 1-888-251-1010. And we can answer any question that you have. If our resource person can't answer it herself, she can come and ask me the question. I'll give you some examples of questions that we get every day. Let's say the patient's taking, a really long list of different medications, and you want to put them on supplements, and you're just not quite sure that you can sort all of it out yourself. The online health test didn't ask about every one of those drugs. Just call us or email us. We'll get you the answer. Or the patient has a health condition that's not asked on the online health assessment. Let's say they have a daughter with osteogenesis imperfecta, and you want some advice on them, you call us. Or if you're looking for the children's dosage of certain Adiva supplements for a specific condition, call us or email us. Or if you need any information on any ingredient in an Adiva product, we can provide additional information to you. So what have you accomplished by these 3 steps? What are the 3 steps? They do the assessment, you book a 20-minute consultation, you provide the right supplements for them with some background literature for them to assure themselves that you've identified things accurately. So what have you accomplished in this little 20-minute consultation? Well, the patient now knows that you've identified all the relevant health risks that are important for them, and they're grateful to find someone who's intelligent enough to give them tangible, evidence-based advice around diet, exercise, and supplementation and lifestyle practices. They can now go, you know that cupboard they have that's full of vitamins they've been storing for the last 15 years, and sometimes they take this and someone talked them into that, a multi-level person sold them. They can now get all that stuff out of the cupboard and get onto a targeted, streamlined program. You've taken the confusion out of it for them. You've also worked within the existing medical management of their condition. You don't put them in this conflict situation where they say, well, I don't know, we've made sure that it's not in conflict with any drugs that they're taking. And you've provided additional resources where they can obtain more information to satisfy themselves that your recommendations are highly accurate. So now the patient sees you differently and they start to become dependent on you in a different way for more global health management. And they also have to come back to your office every month to get supplements. So our Adiva supplements are built whereby after 30 days they run out, they have to come back to your office to get those supplements. And so while they're there, it becomes part of the overall maintenance program you want for them anyway. So now the patient is relying on you, and they're also asking you about other family members that they have, not just for musculoskeletal conditions, but all the global health management. And they start to tell other people how you provided them with a service that goes way beyond what's expected in a chiropractic office. And so they start to refer patients to you that have health conditions where standard medical management has been less than satisfactory. This happens all the time. Patients have had a bad reaction to a drug, or they're prescribed a drug and they go online and they find out that it can damage their liver or get them erectile dysfunction, or it's going to increase the risk of congestive heart failure, cause internal bleeding. They're saying, I wonder if there's something more natural. Oh, I know who to send you to. Or they want to reduce the reliance on a particular drug. Let's say it's a statin drug to lower cholesterol. They want to know what can they do naturally so that even if they're on a drug, they could maybe use a lower dose. Or they're taking drugs that are not really helping enough and they're looking for some additional help, or the drug has a horrible side effect, let's say autoimmune drugs as an example, and they want to have some more complementary care to see if they can reduce their reliance on those things. I will tell you, everyone knows people in these situations. And so when those new patients show up as new patients, you simply, in addition to your nutritional consultation, explain the importance of periodic chiropractic care to maintaining a highly functional body. Everyone needs chiropractic care. What's the result? You have a bigger practice, it's more profitable, you're getting more referrals without doing anything cheesy, and you're building a maintenance practice based on the managed healthcare model, which is required today, not just for musculoskeletal conditions, but for the global management of the person's health. The practice becomes much more rewarding. I've even done this for you. I have a PowerPoint presentation and seminar that I teach on this subject called Conquering the Genetic Time Bombs of Aging and Disease Naturally. You can use it as your in-office healthcare class or for corporate seminars or community lectures. And it highlights how the body's aging clock works and the importance of targeted supplements and lifestyle factors in preserving your functional life, reducing risk of degenerative disease, and improving the chance for longevity. So you can download the PowerPoint presentation right from adivainfo.com, your resource site. And if you, on the home page, if you go to the top left-hand corner, you'll see a little button there, a link that says, listen to Dr. Machino's Patient Wellness Seminar. You can actually listen to me teach that seminar so you'll know how to present it. It's been highly effective for my career, I can assure you of that. So now you establish yourself as a comprehensive health expert beyond that of just musculoskeletal expertise that they already assume that you have. So in today's healthcare climate, I can tell you that managed healthcare involving evidence-based diet, supplementation, exercise recommendations is the missing link that people are looking for and they badly need the guidance in this particular area. So you have the opportunity, by including it, to improve the patient's health to a much greater degree, more than just chiropractic adjustments alone can accomplish, to extend their years of having a functional life and prevent the most prevalent life-threatening ailments that people are faced today in our society. They're faced with today in our society. And you can help them counter the genetic time bombs of aging to preserve their functional life. So it really helps you build the practice of your dreams. That's why you went to school. You'll end up with well-educated patients, patients who really resonate with the wellness care message. And what is wellness? It's the active daily pursuit of maintaining an optimal state of health, or working to get back to a more optimal state of health. It's not about being passive. It's the chiropractic philosophy where people are engaged, but they have to know what to do and they need guidance in this area. So, and these are the most stimulating patients to have in your practice, let's be honest. So I have given you all the tools that you need to attract those patients and provide them with relevant scientific-based solutions in their quest for better longevity and quality of life. Adiva and I are truly committed to your success in this area. So I would encourage you to call our Director of Chiropractic Resources today, and she will help you implement this turnkey wellness program at no charge. And by calling her, it will really ensure your success in building a highly profitable managed healthcare practice. Thanks so much for watching, and let's take chiropractic to the next level. The world badly needs your help. Thanks again.